Hi, it's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my husband is in intensive care with pancreatitis and liver failure. He's on a ventilator, in an induced coma, and he's bleeding. Help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my uncle is on BIPAP after 2 weeks on the ventilator, and the doctors think that putting the breathing tube back in is futile. What does it mean? This question from Rebecca formed part of an email consulting and counseling strategy session with me. So, Rebecca writes: Hi Patrick, my uncle has been in intensive care for 4 weeks. He has end-stage COPD and he's 76 years of age. He was on the breathing tube and on the ventilator for 2 weeks, and he came off the ventilator now. For the last 2 days he has been on BIPAP most of the time. He has a temperature and a chest infection. They put my uncle on antibiotics. The doctors didn't have much hope for him last week. Is this an improvement of being on BIPAP after 2 weeks on a ventilator? They are now saying that they don't want to put the breathing tube back in, and the doctors are saying that it could be futile putting the breathing tube back in. What does that all mean? They are now talking about sending him to HDU, which is high dependency unit. I'm wondering, would it be better for him to stay in ICU? We love our uncle dearly and he wants to live, and we want him to live. Please help. Thanks, Rebecca. Here's my response. Hi Rebecca, thank you for sending through your questions and also for signing up for my one-on-one counseling and consulting via email. I really appreciate it. The situation your uncle is in is certainly a difficult situation, and it's also a difficult situation for you and your family to watch your uncle suffer whilst you're worried that he may not survive his ordeal in intensive care. Here's what's happening from a clinical perspective, Rebecca. Your uncle has end-stage COPD, and initially the intensive care team decided to ventilate him with a breathing tube. He probably came to intensive care because he had lots of issues breathing and he was short of breath. His chest X-ray as well as his breathing were most likely compromised, and he would have struggled to breathe. He therefore ended up on a breathing machine with a breathing tube. On top of that, his blood gases would have been compromised too, meaning that his arterial blood had low oxygen levels and high carbon dioxide levels. Therefore, mechanical ventilation, induced coma and sedation were the only way to keep your uncle alive to begin with. After your uncle had a couple of weeks on the ventilator and also had some time to rest his lungs and his body, it was time to wake him up from the induced coma and find out whether he could breathe by himself or not. For any critically ill patient in intensive care on a ventilator for more than 7 days, The inevitable question will be whether they can be extubated, which is basically the removal of the breathing tube and the ventilator, or on the other hand, whether they still need ventilation support and the induced coma to keep them alive on life support. If the intensive care team thinks that your uncle wouldn't be able to breathe properly without the ventilator and the breathing tube, they would have explored two options that they should have discussed with you and your family in detail before actually talking about futile treatment. The first option would have been perform a tracheostomy to continue ventilating your uncle without being in an induced coma. The tracheostomy would enable your uncle to get out of the induced coma quickly, as critically ill patients don't have to be sedated whilst being ventilated via a tracheostomy. They have to be sedated and in an induced coma whilst being ventilated with a breathing tube or an endotracheal tube through the mouth, as it can't be tolerated without sedation. You should also check out a related article and a related video about tracheostomy. How long should a patient be on a ventilator before having a tracheostomy? You can Google that and you'll find the article and the video on our website. The next option is that the intensive care team might have considered and looked at your uncle's age at his end-stage COPD, and they might have thought that doing a one-way extubation might be quote-unquote in the best interest for your uncle. Now let me explain this in more detail. A one-way extubation basically means that removing your uncle from the induced coma and taking him off the ventilator by removing the breathing tube in his mouth would be a procedure that's only done once. It means that after the breathing tube has been removed, it's not to go back in. COPD is a chronic and progressive disease that sooner or later obstructs and narrows the airways, and therefore it's irreversible. Usually in COPD, the patient has a decreased ability to exchange oxygen and carbon dioxide in the lungs, leading to abnormal respiratory patterns. This can lead to less tolerance for infections, and patients tend to have little tolerance for exercise as well, often shown through shortness of breath after climbing stairs or doing any other activity. Ventilation and induced coma are usually only life-saving measures in the interim. It won't cure your uncle's COPD. However, some COPD patients in intensive care also end up with a tracheostomy to aid with their breathing in the long term. It really depends what your uncle and your family want, and also how prepared you are to negotiate with the intensive care team for what you want. If you are like 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, don't have control, don't have power, and don't have influence, you'll take everything for face value that the intensive care team is telling you, and you don't question. Given that you are doing your own research already, and given that you are willing to question, and given that you are seeking independent advice, I know for a fact that you don't belong to the 99% of the families. In order for you to make informed decisions, however, get peace of mind, get power, get control, and get influence, you need to mentally prepare yourself to get what you want. You need to start asking the right questions, and you need to be in a good mental state to challenge the intensive care team and their assumptions. Your uncle might be better off staying in intensive care, getting a tracheostomy, and slowly try and wean him off the ventilator over time. If your uncle is going to HDU, to the high dependency unit, there is less chance for him to get a tracheostomy, because performing a tracheostomy is usually a procedure only done in intensive care. If your uncle will be going to HDU or the high dependency unit, it means he will be downgraded in terms of care and treatment he will get. Therefore, it's only logical that he will only get BIPAP and not tube ventilation. Once your uncle will be in high dependency or HDU, there will also be a fair chance that he may not go back to intensive care, because the intensive care team thinks, again, it may be in your uncle's quote-unquote best interest. This is also why the intensive care team is talking about futile treatment. Futile medical care is the continued provision of medical care or treatment to a patient when there is no perceived or reasonable hope of a cure or benefit. It's basically the perception of the intensive care team that any treatment beyond the BIPAP is futile. It certainly is an improvement, Rebecca, that your uncle is now on BIPAP and not on the ventilator anymore. The question, however, remains, would mechanical ventilation with a breathing tube and then tracheostomy improve your uncle's quality of life? It's difficult to answer that question. However, I always believe that people should put their best foot forward rather than being negative and suggest that treatment may be futile. It's also important to note that in this day and age, tracheostomy and ventilator dependency is something that people can live with at home as well. What if you and your family want to spend more time with your uncle over the last few weeks or months that he has to live? If your uncle gets a tracheostomy and remains on the ventilator, there are specialized intensive home care nursing services that can provide 24-hour care at home instead of your uncle staying in intensive care. You should check out Intensive Care at Home for more information. Again, futility is a perception and an opinion. The question is, what's your perception and your opinion? What's your gut feeling telling you? Intensive care teams have an agenda that go way beyond your critically ill loved one's prognosis and diagnosis. There are just too many things happening in intensive care behind the scenes. Families in intensive care can't be oblivious to the things that are happening behind the scenes in intensive care. Everything that's happening behind the scenes in intensive care is impacting on how the intensive care team communicates with you. Everything that's happening behind the scenes in intensive care is impacting on how the intensive care team frames and positions your uncle's diagnosis and prognosis. Things that are happening behind the scenes in intensive care include managing the finances and other resources, as well as politics, dynamics and hierarchies, and I'm only scratching the surface here. The question really is, do you buy into it because you are intimidated by the perceived power and the perceived authority of the intensive care team? Or are you committed to negotiating your terms and conditions? As I have mentioned before, Rebecca, 99% of the families in intensive care don't make informed decisions. They don't get peace of mind, they don't get control, they don't have power, and they don't have influence. The reason you are here is that you want to make informed decisions, you want to get peace of mind, you want to get control, you want to get power, and you want to get maximum influence. State what you and your family want for your uncle in no uncertain terms, and don't get him to HDU. The BIPAP may work for him, but it may not. They can use the BIPAP in intensive care to start off with. If it doesn't work, you and your family may want to reconsider putting your uncle back on the ventilator with a breathing tube and then get a tracheostomy. As long as you don't try, you simply will never know. Wishing you all the best, Rebecca. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly, whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insights so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find our international phone numbers on our contacts tab. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype, over the phone or via email by clicking on the tabs. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.